everyone. Welcome back for another deep dive. Today, we're going to be looking at something I found super interesting when I was doing the research for this one.
Wait, yeah.
It's all about the healthcare system
Okay.
in Tamil Nadu, India.
Interesting.
Yeah. So, we hear a lot about healthcare, globally, and we're kind of zooming in and focusing on one specific region here.
Right.
And what I found was really fascinating about the way they do healthcare is kind of bucking the trend of what we see in a lot of places.
Yeah. You know what's so intriguing about Tamil Nadu is that they've really prioritized building up their public healthcare system.
Yeah.
And not just in terms of like fancy buildings and equipment,
Right.
but like the quality of care that they provide in these public hospitals is really impressive.
Yeah, and that was the thing that really surprised me when I was going through the material for this episode.
Yeah.
Because, you hear so much about, the struggles of public health care in different countries around the world. And so to see this system that's really thriving and producing some good results, I think it's a really valuable case study.
Absolutely.
So I'm wondering if you could give us a little overview of, how does the system actually work?
Sure. So at its core, they have this three-tiered system.
Okay.
Primary, secondary, and tertiary.
Okay.
So primary care is your kind of first point of contact, right? Your community health centers dealing with preventative care and common illnesses. Then you have secondary care, which is your district hospitals, a bit more specialized treatment.
Okay.
And then tertiary care, that's where you have your major hospitals handling the really complex cases, surgeries, and all that.
Right, so that structure kind of sounds similar to what we see in a lot of places.
It does, yeah.
But what makes it unique in Tamil Nadu?
I think one of the key differentiators is the emphasis they put on the quality of their public hospitals.
Okay.
These hospitals are often considered to be better than or at least as good as private hospitals in terms of the affordability and the accessibility for most people.
Wow.
And that brings us to one of their flagship programs, the Chief Minister's Comprehensive Health Insurance Scheme, or CMCHIS.
Yes, I was going to ask about that.
Yeah.
Because I saw that in the source material, and it seemed like it was a lot more than just basic coverage.
It's incredibly comprehensive.
Okay.
It provides coverage of up to 5 lakh rupees per family per year.
And that's equivalent to?
Which is over $6,000.
Wow. Okay, so that's a significant amount.
Yeah, it's a really big deal, and it covers both public and private hospitals.
Oh, wow.
So it gives people a lot of choice in where they seek treatment.
So it's kind of a unique element, right, to include private hospitals in this.
It is, and it kind of raises some interesting questions about how they manage the cost.
Right, because you would think that would increase the cost.
You would think so.
Yeah.
But by including private hospitals, they're essentially expanding the capacity of the system, right?
Okay.
So more people can access care, but then it does lead to questions about how do you control costs? How do you ensure equitable access?
Right. Are the private hospitals inflating prices?
Exactly. Those are all challenges they're working through.
It's a complex system.
It is.
But it's fascinating to see all these different elements.
Absolutely.
So we've talked about the insurance, but there was another program that I saw mentioned in the research that I thought was really ambitious.
Okay.
Which is the free drugs and diagnostics program.
Yeah. That's a huge part of their system.
How do they manage that? I mean, is it literally free for everyone?
Essentially, yes. It is, and the key to this program is a really, really efficient supply chain.
Okay.
They've invested heavily in logistics,
right,
making sure that essential medicines and diagnostic tools reach even the most remote corners of the state.
Wow.
And they have really strict quality controls, too.
That makes sense.
Especially with pharmaceuticals.
Yeah. You don't want to be messing around with quality.
Exactly.
So it's not just about providing the care, right? It's also about making sure people can access it quickly.
Right.
And I know they have these dedicated phone numbers.
Yeah, the 108 and the 104.
Yeah, for emergencies and health advice. Yeah.
Exactly. So the 108, that's their ambulance service.
Okay.
And they've gotten a lot of recognition for their really fast response times.
Wow.
They have this centralized dispatch system, and they've strategically placed ambulances all over the state.
Okay.
So they can get to people quickly. And that's particularly crucial in emergency situations, right?
Right. Every minute counts.
Exactly. Now, the 104 helpline, that's more for general health advice.
Okay.
Preventative care kind of thing.
Interesting. So they've really thought through that whole patient journey.
They have, yeah.
From the moment someone needs care to getting that treatment.
They've tried to make it as seamless as possible.
But even with all these positive initiatives, I'm sure there are challenges, right?
Of course.
Every healthcare system has its weaknesses.
Absolutely.
Yeah.
In fact, some of the challenges that Tamil Nadu faces are actually a result of their success.
Oh, how so?
Well, for example, the high quality and affordability of their public hospitals
Okay.
has led to a problem of overcrowding.
Oh, wow. So too many people want to go there.
Exactly, the sheer volume of patients seeking treatment can really strain resources sometimes.
Right.
And it can lead to longer wait times.
So it's almost like a good problem to have.
It is in a way.
Yeah.
But it's still a problem that needs to be addressed.
Right. It's kind of a balancing act.
It is, and they're trying to address it in various ways. Expanding facilities, optimizing staffing levels, streamlining patient flow.
Right.
It's an ongoing challenge, and it's made even more challenging by the fact that they also have an influx of patients coming in from neighboring states.
Oh, really?
Yeah, because the quality of care is so good, and it's so affordable.
Yeah, if I lived in an area with a less developed healthcare system, I might be tempted to travel to Tamil Nadu.
Exactly. And that adds another layer of complexity, right? Because
Yes.
how do you balance the needs of your own population with the needs of people coming in from outside?
Yeah, and how do you prevent that influx from further exacerbating disparities that already exist within the state?
Exactly. You're hitting on another key challenge they face,
Which is,
the disparity between urban and rural areas.
yeah, that was something that jumped out at me from the research as well.
Yeah, well, Tamil Nadu has made great strides in expanding healthcare access overall.
Right.
There are still significant gaps between urban centers like Chennai
Right.
and more rural districts.
And I know the research mentions some specific districts.
Yeah, Dharmapuri, Krishnagiri, Nagapatnam.
Yeah.
They're all facing shortages of advanced medical facilities.
Okay.
And they have a really hard time attracting and retaining qualified doctors in these rural areas.
Yeah, I can imagine that's a challenge in a lot of countries.
It is a common problem, but it's particularly acute in Tamil Nadu,
Okay.
just given the concentration of high-quality facilities in the big cities.
Right. So are they doing anything to address this rural-urban divide?
They're trying various things like offering financial incentives to doctors who are willing to practice in rural areas,
Okay.
housing subsidies, professional development opportunities.
Okay.
They're also investing in telemedicine and mobile health units to try and reach those remote communities.
So kind of expanding the reach of specialists without
Exactly.
necessarily having to relocate them. So it sounds like they're taking a multi-pronged approach to try and bridge that gap.
Yeah, they're really trying to tackle this issue from all angles.
But on top of all these challenges we've already discussed, there's also the rising burden of non-communicable diseases.
Yeah, that's a global trend.
It is, but how is it specifically impacting Tamil Nadu?
Well, they're seeing a sharp rise in cases of diabetes,
Okay.
hypertension, cardiovascular disease,
Yeah.
cancer.
Yeah.
And, a lot of factors are contributing to this.
Really good.
Air pollution, particularly in industrial zones,
Yeah.
and also lifestyle changes.
Right. So it's not just about treating these diseases.
No,
It's about preventing them in the first place.
exactly. They're focusing on health education, promoting healthy lifestyles,
Okay.
encouraging regular checkups, and integrating preventative care into that primary healthcare system we talked about.
Right. So they're trying to catch things early
Exactly.
and hopefully prevent those conditions from developing in the first place.
Yeah. Early intervention is key.
So it seems like they're taking a very holistic approach to this problem.
They are.
But one thing that surprised me when I was reading about Tamil Nadu's healthcare system was the role of the private sector.
Oh, yeah.
Because we've been talking about all these public initiatives.
Right.
But it's not just a public-only system, is it?
No, it's not.
There's a private sector, too.
Absolutely. Tamil Nadu actually has a very thriving private healthcare sector
Okay.
with some world-renowned hospitals,
Like,
Apollo MIOT.
yeah, I've heard of those.
Yeah. So it's not an either-or situation.
Right.
The public and private sectors coexist and in some ways complement each other.
So I'm curious about that dynamic.
Okay.
Do these private hospitals mostly cater to the wealthy?
They do serve a wealthy clientele, but there's actually quite a bit of interaction with the public system.
Oh, really?
Yeah, remember the CMCHIS?
Yeah, the comprehensive health insurance.
Yeah, that scheme actually covers treatment in private hospitals as well.
Oh, wow. So even people who are relying on government insurance can access these high-end private facilities.
They can, and it might seem counterintuitive,
Yeah.
but it's actually a strategic way to leverage the capacity of the private sector to increase access for the poor.
Okay, so they're basically saying, okay, we have this really robust public system,
Right.
but we also recognize that the private sector has capacity.
Exactly.
And so let's leverage that.
Exactly. And it expands the pool of available resources,
Right.
and it gives patients more choice.
So it's almost like creating this hybrid model
It is a hybrid model.
that combines the strengths of both systems.
Exactly. And it's not just limited to the insurance scheme either.
Okay.
There are public-private partnerships where Corporate hospitals are providing free heart surgeries,
Wow.
free cancer care for families below the poverty line.
That's incredible.
And there are collaborations between NGOs, private labs, and the government to offer free diagnostic programs.
So they're really trying to work together.
They are. It's a very collaborative approach.
It's amazing to see that level of collaboration.
It is, and I think it speaks to their commitment to providing quality health care for all segments of society.
Right, regardless of their income level.
Exactly.
So it's really a fascinating model.
It is.
And one that I think we can learn a lot from.
Absolutely.
So what does this all mean for our listeners?
Okay.
Why should they care about what's happening in Tamil Nadu?
Well, I think there are a few key takeaways here.
Okay.
First, Tamil Nadu demonstrates the power of political will and commitment. They've made healthcare a priority, and they've backed it up with sustained investment in innovative policies.
It's not just about throwing money at the problem, though, is it?
No, it's not.
It's about being smart and targeted with those investments.
Exactly. And their success shows that it is possible to achieve universal healthcare coverage and quality outcomes. Even without unlimited resources, they've had to be very creative and strategic.
And the second takeaway, I think, is the importance of collaboration and partnerships.
Absolutely.
They've shown that the public and private sectors don't have to be adversaries.
They don't.
They can work together towards a common goal.
Yeah. They've also shown the importance of engaging NGOs, community organizations, even corporate entities in this healthcare ecosystem.
It's a true community effort.
It is.
And finally, I think Tamil Nadu offers a valuable lesson in adaptability and innovation.
Yeah.
They're not afraid to experiment, to try new things, and to constantly evaluate and improve their system.
They're always looking for ways to refine their approach, address emerging challenges, and leverage new technologies to improve healthcare delivery.
So even though we're just scratching the surface here,
Right.
it's clear that Tamil Nadu has a lot to offer in terms of lessons learned and inspiration for other healthcare systems around the world.
Definitely.
So what are your final thoughts on this?
Well, I think Tamil Nadu's journey in healthcare offers a really compelling narrative of innovation and perseverance.
Okay.
You know, they've tackled these challenges head on and constantly adapted and refined their approach to meet the evolving needs of their population.
Yeah, it's really inspiring to see what they've been able to accomplish.
It's a testament to what can be achieved with focused determination and a genuine commitment to serving the people.
Yeah. And it's been really fascinating to explore their system with you.
It has.
So we started by uncovering the surprising success of their public hospitals.
Right.
And then we dug into some of the initiatives that are driving that success, like the CMCHIS.
Yeah.
The focus on those robust supply chains. We talked about some of the challenges that they face, the overcrowding, the rural-urban disparities, the rising tide of non-communicable diseases.
Yeah.
And we wrapped up by examining that intriguing dynamic between the public and private healthcare sectors.
Absolutely.
That collaboration that seems to be working really well for them.
Yeah, and I think that's the essence of what makes Tamil Nadu's story so captivating.
Okay.
It's not just about replicating their model.
Right.
It's about extracting those valuable lessons that can inspire innovation and positive change within our own healthcare systems.
It's about thinking outside the box.
Exactly.
And looking at what's working in other places.
And asking ourselves, what can we learn from their successes?
Right.
What can we adapt to fit our own unique contexts?
What can we do differently to create a healthier future
for
everyone?
Yeah, and this deep dive has hopefully provided a starting point for those reflections.
Right.
But it's just the beginning.
Right. There's always more to explore.
Exactly.
So we want to hear from you, our listener.
Yeah.
What aspects of Tamil Nadu's approach resonated most with you?
What sparked your curiosity?
What questions are swirling in your mind right now?
Maybe you're pondering the feasibility of replicating certain aspects of their system within your own community or country.
Maybe you're interested in delving deeper into the specifics of their supply chain management or their strategies for tackling those rural-urban disparities.
Or maybe you're just inspired by their unwavering commitment to providing quality healthcare for all.
Yeah.
Regardless of socioeconomic background.
Whatever your takeaway, we encourage you to continue exploring.
Yes.
Keep researching. Keep engaging in those meaningful conversations about healthcare.
Because ultimately, the pursuit of better healthcare is a collective endeavor.
It is.
It's a journey we embark on together.
Right.
Drawing inspiration and knowledge from diverse sources.
And Tamil Nadu certainly provides a compelling example.
It does.
So that brings us to the end of this deep dive.
Okay.
We hope you found it insightful.
And thought-provoking.
And perhaps even a bit inspiring.
Yes.
Until next time, keep learning, keep questioning, and keep diving deep.
See you next time. Has led to a problem of overcrowding.
Oh, wow. So too many people want to go there.
Exactly. The sheer volume of patients can sometimes, really strain resources.
Right.
And it can lead to longer wait times.
So it's like a good problem to have in a way.
It is, in a way, but it's still a problem that needs to be addressed.
Right. So how are they addressing that?
Well, they're trying various things,
Yeah.
like, expanding facilities, optimizing staffing levels, streamlining patient flow.
Okay.
But it's an ongoing challenge for sure.
Right. And it's made even more challenging by the fact that you mentioned they're also getting patients from neighboring states.
Right, because the quality of care is so good.
Yeah.
And it's so affordable, people are willing to travel to get it.
Yeah, I can see that.
And that adds another layer of complexity to the whole thing.
Right, because now you're not just dealing with
Exactly.
your own population.
How do you balance the needs of your own population with people coming in from outside?
Right, and how do you prevent that influx of patients from other states from kind of exacerbating the disparities that might already exist in Tamil Nadu?
That's a really good point.
And speaking of disparities, the urban-rural divide was something that I noticed in the research as well.
Yeah, that's another major challenge they're grappling with.
Can you talk a little bit more about that?
Sure. So while Tamil Nadu has made huge progress in expanding healthcare access overall,
Yeah.
there are still significant gaps between those urban centers like Chennai
Right.
and the more rural districts.
And I know the research mentions some specific districts.
Yeah, like Dharmakuri,
Yeah.
Krishnagiri, Nagapattinam.
Okay.
They're all facing shortages of those advanced medical facilities and specialists.
It's hard to attract doctors.
It's really hard to attract and retain qualified doctors in those rural areas.
Yeah, I imagine that's a problem a lot of places face.
It is a common problem, but it's especially acute in Tamil Nadu
Okay.
because of that concentration of high-quality facilities in the big cities.
Right. So are they doing anything specific to try to address that?
Yeah, they're trying a variety of things. For example, they're offering financial incentives
Okay.
to doctors who are willing to practice in rural areas. Okay, makes sense. Housing subsidies, professional development opportunities.
Right. So make it more appealing.
Exactly.
Yeah.
They're also investing in things like telemedicine
Yeah.
and mobile health units to try and extend the reach of those specialists.
Right. So you don't necessarily have to physically relocate
Exactly.
peers,
You can bring the expertise to the patients.
which is great.
Yeah. So they're really trying to tackle this problem from multiple angles.
It sounds like it, but, in addition to these challenges we've already talked about,
Yeah.
there's also that global trend of the rise of non-communicable diseases.
Right. NCDs, those are a major concern everywhere these days.
They are, but how is it impacting Tamil Nadu specifically?
Well, they're seeing a significant increase in cases of things like diabetes,
Okay.
hypertension, cardiovascular disease, cancer, all the big ones.
Yeah.
And, there are a number of factors contributing to this.
Like what kinds of things?
Well, air pollution is a big one,
Okay.
particularly in those industrial zones. And then, of course, there are lifestyle changes,
People are more sedentary,
Exactly. Diets are changing.
so it's not just about treating these diseases.
No, it's not.
It's about trying to prevent them.
Absolutely. Prevention is key, and they're really focusing on that.
Yep.
So, health education, promoting healthy lifestyles,
Okay.
encouraging regular checkups, and really integrating that preventative care into that primary healthcare system we talked about.
Right. So trying to catch things early.
Exactly. Early intervention is so important.
Ooh, I could see that.
Yeah. So they're really trying to take this holistic approach.
Okay, so it's not just about treating people when they're sick.
No.
It's about trying to keep them healthy in the first place.
Exactly.
Which is great.
It is a very forward-thinking approach.
Now, one thing that surprised me when I was reading about Tamil Nadu's healthcare system was the role of the private sector.
Oh, interesting.
Because, we've been talking about all these amazing public initiatives.
Right. It's not just a public system, though, is it?
No, it's not.
They have a private sector as well.
Yeah, there is a private sector.
And it's a pretty thriving one, actually.
Really?
Yeah. Tamil Nadu has some world-renowned private hospitals.
Like what kind of hospitals?
Like Apollo,
Oh, yeah.
MIOT.
I've heard of those.
Yeah. So it's not a situation where it's either public or private.
Right.
They coexist and in some ways complement each other.
So I'm curious about that dynamic. How does that work?
Okay.
Do these private hospitals primarily cater to, the wealthy?
Well, they do serve a wealthy clientele.
Okay.
But there's actually a lot of interaction with the public system.
Oh, really? How so?
Well, remember the CMCHIS?
The Comprehensive Health Insurance.
Yes. That scheme actually covers treatment in private hospitals as well.
Wow. So even people who are relying on government insurance can access these private facilities.
They can, and it might seem kind of counterintuitive.
Yeah, you would think that would drive up costs.
You would, but it's actually a very strategic way to leverage the capacity of the private sector.
Okay.
To increase access for the poor.
So they're saying we have this great public system,
Right.
but we also recognize that the private sector has a lot of capacity.
They do.
So let's use it.
Exactly. It expands the pool of available resources.
Makes sense.
And it gives patients more choice.
So it's almost like they've created this hybrid model.
It is a hybrid model.
That kind of combines the strengths of both
exactly.
public and private.
And it's not just limited to the insurance scheme.
Okay.
There are also these public-private partnerships where you have corporate hospitals providing free heart surgeries.
Wow, that's amazing.
Free cancer care for families below the poverty line.
That's incredible.
Yeah, and you also have collaborations between NGOs, private labs, and the government to offer free diagnostic programs.
Wow, so it really is a very collaborative approach.
It is. They're really trying to work together to make this system work for everyone.
Yeah, that's amazing to see.
It is, and I think it speaks to their commitment to providing that quality health care for all segments of society, regardless of their income level.
It's really inspiring.
It is.
And it's a model that I think a lot of other places could learn from.
I agree.
So what does this all mean for our listeners?
Okay.
Why should they care about what's happening in Tamil Nadu?
Well, I think there are a few key takeaways here.
Okay.
First, Tamil Nadu really demonstrates the power of political will and commitment.
Okay.
They've made healthcare a priority, and they've backed that up with sustained investment and innovative policies.
So it's not just about throwing money at the problem.
No, it's not. It's about being smart.
Okay.
Targeted with those investments.
Right, and being creative.
Exactly. And I think their success shows that it's possible to achieve universal healthcare coverage and quality outcomes, even without unlimited resources.
Right.
They've had to be creative.
And strategic.
Exactly.
And the second takeaway, I think, is the importance of collaboration and partnerships.
Yeah.
You know, they've shown that the public and private sectors don't have to be adversaries.
They can work together towards a common goal.
And they've also shown how important it is to engage those NGOs, community organizations, even those corporate entities.
Exactly. Bring everyone to the table.
It's a real team effort.
It is.
And finally, I think Tamil Nadu offers a valuable lesson in adaptability and innovation. You know, they're not afraid to experiment.
Right. Try new things.
To constantly evaluate and improve their system.
Exactly. Always looking for ways to do things better.
Yeah. So even though we were just scratching the surface here, it's clear that Tamil Nadu has a lot to offer.
A lot to teach us.
Yeah, in terms of lessons learned and inspiration.
For sure.
So what are your final thoughts on this, and what do you think our listeners should really take away from this deep dive?
Well, I think, Tamil Nadu's journey in healthcare, it's a really compelling story. Of innovation and perseverance.
It really is.
They haven't shied away from challenges.
Right.
They've tackled them head on, and they've just constantly adapted, refined their approach to meet the needs of their people.
And it's really paid off for them.
It really has.
It's inspiring to see what they've been able to accomplish.
Absolutely. It's a testament to what can be achieved, with that focus and determination and a genuine commitment to serving the people.
And it's been fascinating to kind of explore their system with you today.
It has been a great conversation.
So we started out by kind of uncovering that surprising success of their public hospitals.
Yeah.
And then we dug into some of those initiatives that are driving that success. Like the CMCHIS.
Yeah, the insurance scheme.
The focus on those robust supply chains.
Yeah, absolutely essential.
We talk about some of the challenges they face, the overcrowding, the rural-urban disparities, the rise of those non-communicable diseases.
That's a complex landscape.
It is. And then we wrapped up by looking at that really interesting dynamic.
Yeah. Between the public and private sectors.
That collaboration is really key.
It is, and it seems to be working well for them.
It really does.
And I think that's what makes Tamil Nadu's story so captivating.
You know, it's not just about replicating their model exactly.
Right.
It's about taking those valuable lessons
Right.
and figuring out how we can apply them in our own contexts.
It's about thinking outside the box.
Exactly.
Looking at what other people are doing.
You're saying, okay, what can we learn from their successes?
What can we adapt?
What can we do differently?
To create a healthier future for all.
Exactly, because at the end of the day, that's what we all want. It is a healthier future for everyone.
And this deep dive has hopefully, given people a starting point for some of those reflections.
It's a jumping off point.
Yeah, but it's just the beginning.
Right. There's always more to learn.
So we want to hear from you, our listeners.
Yeah, what are your thoughts?
What aspects of Tamil Nadu's approach really resonated with you?
What sparked your curiosity?
What questions are you left with?
Maybe you're thinking about, could we do something like this?
Yeah, can we replicate some of these things?
In our own community?
In our own country?
Maybe you're interested in learning more about how they manage their supply chain.
Yeah, that's a fascinating aspect.
Or how they're dealing with those rural-urban disparities.
Or maybe you're just inspired by their commitment to providing quality healthcare for everyone.
No matter who they are.
Exactly.
Whatever it is, keep exploring.
Yeah, keep the conversation going.
Keep researching. Keep asking questions.
Because ultimately, the pursuit of better healthcare, it's a collective endeavor.
It is.
Something we have to do together.
And we can learn from each other.
Absolutely, drawing inspiration and knowledge from all these different sources.
And Tamil Nadu is definitely a great example.
It's a fascinating case study.
So that brings us to the end of our deep dive today.
All right.
We hope you found it insightful.
Thought-provoking.
And maybe even a little bit inspiring. Until next time, keep learning, keep questioning, and keep diving deep.
See you later.